Since 1963, the state of Kuwait has exemplified a model of active dynamic partnership with the United Nations, working collaboratively to promote peace, provide humanitarian support, and drive sustainable development. The World Health Organization is the directing and coordinating entity of the United Nations for health services. The WHO Regional Office for the Eastern Mediterranean is one of 6 regional offices around the world, as it serves the interests of nearly 745 million people in the region. And today we are here at the UN House to witness another chapter of partnership between the State of Kuwait and the United Nations, where we had the pleasure of having an exclusive interview with Dr. Hanan Belkhi, the WHO Regional Director for Eastern Mediterranean, who was here in Kuwait on an official visit.
I'm trying to see what is the best way to link health with economic prosperity within our member states, even if they're small increments, and alleviating a little bit of the unemployment in some of these very troubled countries. We're always ensuring and wanting to make sure that health starts with the people, starts with the community. And you can see here on the other side that there is a large number of men and women and even children from the community. They come to this polyclinic, they get the education, and they take it back to their people.
Dr. Hanan, welcome to the sit down with us today.
شكرا جزيلا على استضافتي. Thank you so much for having me with you.
It's a pleasure. Doctor, let's get into it. You were recently appointed by the WHO as the Regional Director for the Eastern Mediterranean by the Executive Board. Tell us about your vision for tackling health issues in the region.
Thank you so much. Again, it's a good pleasure to be with you to talk about our beloved region. Just to contextualize it, it's a region of 22 countries, of 750 million people. We unfortunately contain within those 22 countries some of the most difficult contexts. We have countries in conflict, we have countries under sanctions, and we have the largest percentage of displaced population within our region. So when I was elected into this position, last year I started in February, I can say now that I have completed 1 full year in this position. In order to implement what the WHO's mandate by the member states is, it was important that I have a clear focus, a clear vision, and prioritize the work that we do in the region to ensure that our mandate is fulfilled to the best of our abilities in attaining health for everyone and leaving no one behind. In doing so, I prioritized restructuring and identifying the role of the regional office in supporting our specific member states, specifically those under conflict. But also I launched three main initiatives. One that will promote and support better access to healthcare and healthcare commodities. And the second one is to tackle the specific challenge that we face in the huge gap of health workforce. And the third one is a very particular initiative or flagship that is tackling the public health challenge of substance use. So in doing that, there needs to be a bit of agility in the work that we do. We have 22 or 21 country offices and one desk office. So the mandate that we have is managed through the functions of the three levels of the WHO in the headquarters of Geneva, the regional office that I lead, and the 21 plus country offices that we have in all of the countries under my leadership.
Dr. Hanan, it's interesting you mentioned your initiative. One of the issues you will tackle is the substance abuse. How or what is the WHO's approach to addressing substance abuse, especially in this region?
Substance abuse is a very complex topic because you're talking about addiction to chemicals, and the causes of it are quite various. Some of it is because of overprescription, some of it is because of trafficking, others is because of the market is quite lucrative for the drug dealers. So it's a very complex political, but also a very important public health challenge that we have. In doing so, I'm working through what is known as the Regional Health Alliance, which the WHO leads among 18 different UN agencies, but also with other partners, in establishing a framework so that each country can customize their own national action plan that is expected to be multi-sectoral, so that each entity, each ministry, each agency is capable of performing what is needed to make sure that our people, our children, our men and women are safe, so that there is less introduction into addiction. But also we have a big role that is already ongoing, but we're going to strengthen it in developing the guidelines, treatment guidelines, assisting our member states in how do they manage the mental health issues of addicts, the rehabilitation, the rules and laws in dealing with people who end up becoming victims of this very challenging problem.
Doctor, it's interesting you mentioned this initiative of addressing the substance abuse. What role are played by the WHO and Kuwaiti government or any government of the member states? Who are also involved, and what are their roles in this process?
This is a great question, and I really am happy that you asked it, because, as I said, the issue of substance use, like many health topics, cannot be managed by government alone. And that's why what we do in WHO, and this has been a trend almost, in developing something that is known as health in all policy. That's one way of tackling the situation. So within even the government itself, there are multiple ministries that have to be engaged, whether it's Ministry of Health, Education, Interior, Foreign Affairs even, media. So several entities have to be aware, and each one have to understand what is their role in their national action plan for substance use. Now, the problem is that I'm starting this initiative from almost ground zero, because there was never a resolution to ask for national action plans to be established at a country level where the different sectors, including the civil society, the private sector, the community, to be part of such initiatives. So the ambition is quite high. And what I'm trying to do is trying to establish with the experts, because it cannot also be WHO alone. The World Health Organization has a role to play, but we're also working with the UN Agency for Drugs and Crime. In fact, we have another event that we're going to be attending together, the WHO and UNODC in Doha later this month. And we will be having expanded brainstorming session on how are we going to frame this topic and how are we going to make it more visible to the governments and to the communities. So the steps that are going to be taken is, first of all, I can assure you that the governments, the member states that I'm dealing with and even beyond are very aware that this is a public health challenge and they want to address it. So that's the first obstacle and we're beyond that. The second step is what is the framework and how can we help in producing the indicators and the framework for the government to lead on this, but then to also engage the necessary entities. For example, when you talk about the private sector, for example, or the community at large, they need to be educated. So how are we going to educate them? What types of messages are we going to give them? How are we going to empower moms and dads and the household to have a close eye so that children do not fall prey for or victims for this type of challenge? So there's going to be a lot of work, and maybe in a year or two, and we can have further discussions on this, and I would be very happy to update you on our progress.
Absolutely, absolutely. Dr. Han, you mentioned your initiatives who are equitable access to medical supplies, the health care workforce, and as well as the substance abuse. How do you think your flagship initiative could benefit economical gain for the region?
Thank you. So on substance use, I'll just say one word on that. There were studies that already shows if we invest $1 in substance use, the return on this investment is between $12 and $14. Apart from saving families from total destruction. When you save families from total destruction and you save the youth, you're already ensuring that your workforce, your people are healthy to work and be economically independent. That's one way of looking at it. On the access to healthcare products, whether the pharmaceutical industry or the medical device industry, I'm really hoping that the pharmaceutical industry specifically flourishes within the region. And in order for it to flourish at an regional or international level where they can go into bids, they can sell their products to the largest number within the markets, we're going to try to support the regulatory authorities to be as independent as possible and be capable of passing what is known as the global benchmark process, which means that they reach a certain maturity level that will allow them to have the needed and proper oversight on the pharmaceutical industry. So we're really hitting several birds with one stone. We're making sure that the regulatory authorities stand on their feet. They're capable to deliver and produce, good surveillance, market surveillance for substandard and falsified medications, for example. They can have good insights into what is coming into the country when it comes to the quality of their drugs, their medications, and their food, if it's a food and drug administration. And at the same time that their pharmaceutical industry is not duplicating the development of molecules or the production of molecules, but they're diversifying their products and that they will be able to sell more. And when they sell more, they're producing more workforce, they're creating more jobs, they're getting rid of unemployment, they're selling, and that has a huge benefit to the economies. I can reassure you that among the many member states, including Kuwait, even Syria, of course, Saudi Arabia, Jordan, Egypt, UAE, they're all very keen on this initiative because it really allows us to not fall in the trap that we had during the COVID pandemic.
Yeah.
And we're not just talking about the mRNA technologies or the very complex vaccines. We're talking about the alcohol hand rub. We're talking about
The basics,
the PPE,
yes.
the very basic needs to respond to an outbreak. Some shelves within the member states that we serve, they don't even have the basic antipyretic. A baby has a fever, they have nothing to control the fever with. So we're hoping that through this initiative, we will bring the member states together to support from the region to the region, and we will have more independence when it comes to national public health security and regional health security.
The flagship initiative is very promising, especially for the region, amid challenges facing through either pandemics or conflict areas. So I hope to see more progress in this. Uh, Dr. Hanan, what are your key objectives visiting Kuwait?
Well, first of all, it's my second country. I love coming to Kuwait. In fact, it was the first country I visited during my campaign. And I always feel like I'm home here. I really came to make sure that we really strengthen the partnerships and specifically tapping into the talent that Kuwait has. The academic centers, the Ministry of Health, the research center. We were at Kuwait Institute for Science and Research. There's huge potential from the region. I'm specifically from Saudi Arabia, as you know, and I trained in the US. But it's very difficult for us to continue to rely on countries from outside the region for our own good and for our own sake of independence when it comes to health. So from the region, from Kuwait al-Habiba, as we would say, there's a lot of partnerships that I also want the opportunity for the Kuwaiti young public health leaders that are upcoming and rising, that they also find an opportunity within the WHO to really work within the global public health community. So I would really love to, maybe I'm doing a little bit of headhunting here, but I would love to poach some of your talent into the World Health Organization, mentor them, work with them, learn from them, to see how can they better benefit the regional and global public health community, and how can they take back lessons to their own home, their own institutions, to make sure that your growth is also continuing and you're what I call it, the public health playground.
Yes. And I strongly believe in the youth being the proper channel
Inshallah.
to broaden this knowledge and hopefully benefit the society as a whole.
Inshallah.
Doctor, before we let you go, an important issue we need you to shed light on is what is the WHO's regional strategic plan when it comes to energy or emergency responses and improving health services for a vulnerable population?
So on emerging pathogens and emergencies, we have to have, and we already have some very robust plans. Part of them are part of the global initiatives. For example, there needs to be internal intelligence at the country level for their own national security on emerging and re-emerging pathogens. The WHO has something called the International Health Regulations. It's quite old. It was established many decades back. The last version came out in 2005, but the member states at the World Health Assembly of 2023 have also approved the updates on the IHR after the pandemic. And the international health regulations is assessed through something called the Joint External Evaluation to look at the preparedness or the readiness of a country to respond to an outbreak or a pandemic. Now, even though many member states in their previous JEEs, they were all greened, many of them were greened, they really responded poorly to the pandemic, which means that we need to go back to the drawing table and understand how do we better increase the capacity of the public health authorities, how do we have better trained public health intelligence, how do we collate that data, and how do we use it for the preparedness and the resilience of the health system. So that's one part of working in this area. And also member states are very keen on our training programs when it comes to the emergency, medical emergency capacities. We have curricula, we have training programs, we work with member states on that. The Access Initiative and the Health Workforce Initiative is to make sure that those capacities already exist. So that's one part of preparing our member states to better respond and to have the resilience that they need. There has to be drills. Hospitals need to go through practices and exercises.
Contingency plan, having the proper contingency.
And having escalation plans also. The intelligence, knowing that, when you have an emergency room and they look at their data every day and they say, okay, every month I have one case of diarrhea. And then this 1 month, I'm having 10 times more. That immediately makes the intelligence go and see what was the cluster, where did they come from, which restaurant did they eat from,
Yes.
which water did they drink. And then you will be able to identify a source, and then you will be able to nip it in the bud, as we
Yes,
say,
that's
and
true.
you stop the spread of that infection. And then you study what were the risks of this source being contaminated. You clean it up, you learn from it, and وهكذا دواليك, as we say in Arabic, and that cycle continues
Yes.
one time after the other. And that's why it's almost like health intelligence. You see something, you pick up a signal,
Yes.
and then you investigate. I can tell you in our regional office, we have the intelligence comes from the social media, comes from hospitals, comes from governments. So it's almost like a feed, and we have to look into those signals and see what is most relevant for us
Relevant,
to react.
credible, yes.
Credible, and then
Yes.
we react with our member states, and it's really for the
And
betterment.
it's also debunking the rumors and the
Yes.
false information that's out there.
Exactly.
That's a really important role, especially for the government when it
Absolutely.
comes to health issues.
But the problem or the challenge that we usually face is that sometimes this information is considered privileged information or classified information, when in reality, for me, as my whole life in public health, I feel that these issues should be more transparent
Yes.
so that we can save more lives.
Absolutely, absolutely. Dr. Hanan, it's been a pleasure having you here. We wish you all the best and success in your initiative. Any last word for our viewers?
Thank you so much. I'm very excited about the prospect of working in close partnership with Kuwait and the people of Kuwait. And I think you can count on me coming back again soon.
Inshallah.
Inshallah.
Thank you,
Thank you
doctor.
so much.